Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
Okay, so Doc is here with us. Hello, Doc.
Hello.
Good afternoon.
Good afternoon.
How are you doing?
I'm well by God's grace.
All right. You're welcome. You're welcome.
Thank you.
And it's week 3 in the month of October. We've been talking about breast cancer. Like I mentioned, today we want to look at some treatment options. We want to look at if there's any preventative actions that we can take, and then we'll talk a bit about awareness creation as well. But I don't know if we can do a quick recap. I mean, it's been 2 weeks now we've been talking about breast cancer. So if somebody has not been listening, or if we've been listening but we've not really been following it, just give us one or two takeouts from what we've discussed so far this month of October.
Okay, so first things first, we should understand that cancer is just the uncontrolled multiplying of cells, and it can happen with any cell in the body. And so the most common one in the world, and actually in women, is breast cancer.
Okay.
Yeah. So the issue is that not enough women are being screened for breast cancer, so we are not detecting them early enough. So we want to create more awareness about that. We mentioned the signs and symptoms. It's not just breast lump that will show it's a breast cancer. Sometimes it's a change in the shape of the breast. Sometimes you see the nipple has changed or has gone inward. Sometimes you see skin changes. Sometimes you feel a lump in the armpits. That could also be a sign of breast cancer. So we have to take note of that. The risk factors. Age, above 50 years, you are more likely. That doesn't mean if you are younger, you are still not at risk. It's possible to also develop breast cancer at a younger age. We talked about the other risk factors, obesity, alcohol, excessive alcohol intake, smoking a lot, and using of hormone replacement therapy, especially for the postmenopausal women. Last week, we talked about the other ways of detecting. Apart from the examination, we talked about the scan, the breast scan. We talked about the mammogram. That's the breast x-ray. And I mentioned once you're above 50, at least every 2 years, you have to get a mammogram done. We talked about the gold standard, which was the biopsy. Either they do a surgery and remove it, or they use a needle to just pull some of the cells out to actually look at the cells directly to confirm the cancer. Yeah, and we also mentioned a bit of the immunochemistry as well. Then we talked about the 5 stages, starting from stage 0 all the way up to stage 4, which is stage 4 is where it has moved to the other body organs and you cannot cure it at that point. But from stage 0 to stage 3, there is treatment for that.
Okay.
Yeah.
Okay. Now, my understanding of cancer generally is that medically it's not been established what actually causes cancer. So even though we talk about certain lifestyle activities that could put one at risk, can we put a hand on something that actually causes this? Has that been established?
Well, there are some established causes, some genes that I mentioned last 2 weeks, that if you have those genes in your body, yes, you are at a very high risk of developing breast cancer.
Okay.
So you have to do some genetic studies, or if it's in your family, you can do those studies and tests to find out.
Okay. All right. Today, like I mentioned, let's look at some treatment options. Later on, we'll look at some preventative actions as well. What are the common treatment options for breast cancer?
Okay, so I think I touched on it last week when I talked about the stages. The commonest one is the surgical removal of the cancerous tissue. Yeah, so depending on the stage and then the size of the lump or whatever it is there, that would determine how extensive the surgery would be. Nowadays, we often just do, if it's small, we just do an excision, remove the lump itself, and then we follow up with radiotherapy to kill off any remaining cancerous cells. Yes, but the bigger it is, the more we have to add other treatments to the surgical therapy. We add chemotherapy, we can add hormonal therapy, especially if the test done shows that the cancer cells are responding to some specific hormones, whether it's the estrogens or progestins or whatever in your body is feeding the cancer to multiply faster. So in those cases, then we give treatments to block the receptors so that they would not receive the signals from those hormones.
Okay.
Yeah.
So the surgical removal, the chemotherapy is another.
Yes. So the chemotherapy is like drugs, but those drugs actually attack any cells that are fast growing, because we know the cancer cells grow very quickly. The unfortunate thing is that there are other cells in your body that grow fast, like your hair, which also grows very fast.
Yeah.
So sometimes when they do chemo, then they lose their hair.
Oh, that's what causes that.
Yes,
okay.
because
I always was wondering.
It's not that specific to only cancer cells, it's to cells that are growing very fast.
Very fast.
Yes. So it has a lot more side effects. Yes. So people, if the earlier we get it, the less likely you are to use chemotherapy, and you just use a radiotherapy after the surgical removal.
Okay.
Yeah.
Okay. Now, how effective are these targeted therapies in treating breast cancer?
Okay. So when we talk about the targeted therapy, it's not so much like the normal chemotherapy, but it targets certain, should I say, proteins that are specific to the cancer cells and the way they are growing.
Okay.
So the targeted therapy actually targets the proteins, so cells which are showing that protein, which shows them as cancer cells, are targeted directly and then are destroyed. Yes. So I'm not sure how common that is currently in Ghana. Yes, but I know it is available. I'm not sure how common, if it's done that much. What I know is popular is more of the chemotherapy and the radiotherapy. Okay,
so so that's the radiation therapy. Because I wanted to know the role that the radiotherapy actually also play in the breast cancer treatment.
Okay, so the radiotherapy is like using, let's say, a laser gun to just burn off or kill off all the cancer cells. Yeah, so there are a few ways it can be done. They can actually do like a targeted, so they point the x-rays directly at the cancerous lump. They do that, I think, several times a week for about 1 to 6 weeks. Yeah, and there's another way that they input a radioactive seed into the cancerous tissue, and they leave it there for a few hours or so for it to work on it, and then they remove those seeds. So that one, I think that one is a bit faster than the normal radiotherapy. It takes fewer weeks of treatment. And then there is also the intraoperative one that whilst they are doing the surgery and they remove the lump in the theater, when they opened up, then they use the rays directly into the tissue to kill off the cells, the cancer cells. Okay. Yeah. So it might
sound a lot.
Yes, it sounds daunting and all that, but the oncologists, the specialists know what they are doing. Okay. And they are skilled, and they know how to do it and to do it very well.
I think the comfort really is in knowing that there's some form of treatment available for people who develop breast cancer. So it doesn't look like all hope is lost. Like
no, not at all. Not at all. It's just that sometimes the treatment might seem a bit radical.
Yeah.
Yes, but we have to treat it that way because the disease sometimes too can also be radical.
Iron sharpeneth iron. Now, are there any latest advancements in breast cancer treatment that we should know about?
Well, not that I know of in the country at the moment.
Okay.
What I know of is what I've mentioned: the radiotherapy, the targeted therapy, a bit of that, and then normally the chemo, and then the surgeries.
Okay. All right. Let's look at prevention because we've earlier on talked about self-examination and getting to identify whether there are lumps in there, coloration, and all that. How effective, tell me, are breast self-exams in detecting breast cancer?
Well, if you do it well enough, Yes, it's actually very, very, very effective. It's never 100%, but if you do take your time to examine, not just to feel for lumps, but you examine, you look at the breast very well, take note of the color changes, you squeeze the nipples to see if there's any fluid coming out that is not normal and all that, you should be able to detect it. And if you do your regular mammograms at above age of 50, you might even notice slight changes between the previous mammogram and the current mammogram. And then when your doctor sees it, they would know the next steps.
Now, I think we need to stress, because the information or what people usually know is looking for lumps. But you've mentioned other things that we should look for when we're examining the breast. So it's not just the lumps. So once we don't feel any lump there, we think that everything is okay, but it might not be the case.
Yes, yes.
Okay. All right. And we've also talked about nutrition. We've talked about lifestyle. Tell me the role that they play in breast cancer prevention and treatment.
Okay. So prevention, not so much, but in the treatment, you have to watch your diet quite a bit. Take more of the fruits, vegetables to boost the immune system. If you are already overweight or obese, you have to work on losing weight. And there's been some studies that show taking green tea also helps.
Okay.
Yes, so maybe you can drink some more green tea once you are on cancer treatment.
I think generally we want to
Yes.
promote a healthy lifestyle,
yes.
a healthy
So
diet as well.
Reduce the fatty foods, reduce the butter, margarine, those kind of things. Maybe stick to like olive oil, avocado oil, those lighter, should I say, seed oils. So those are healthier options.
Okay. We'll be wrapping up shortly. We're looking at breast cancer. Today we've been looking at the treatment options, and we've been looking at prevention. Let's talk briefly on some awareness creation before we wrap it up. And I know that in this month of October, we're talking a lot about creating awareness. Tell me the role that individuals would have to play in promoting breast cancer awareness.
Okay, that's what we are doing here. You just talk about it more and more. You see, people tend to just avoid talking about the issue, but if you don't talk about it, it doesn't disappear. It's still there. So I think it should be something that you should talk about. You should be asking your wife from time to time, at least every month. She should check on her breasts, or you help her to check it and all that. And then if she's older, do the regular routine mammograms to be sure everything is going on well. Just have an open conversation about it.
And it's interesting you mentioned that if you don't talk about it, it doesn't disappear, because sometimes it looks like, as I October, people are talking too much about breast cancer. What is this every time? Breast cancer. You cry, you are putting fear in us. But we have to talk about it anyway. And this month as well, we've been talking about mental health on our programs. Is there any correlation between breast cancer and mental health?
Well, yes. Well, getting the news about breast cancer, or a close relative with breast cancer, will give you the same reaction to any bad news. There's anxiety, there's sadness, there's fear, and all that. So those are normal reactions. Sometimes you are frustrated, sometimes you are angry, like the stages of grief and all that. Those are normal reactions to any bad news. It's just that we have to keep a close eye on those emotions and don't let them overwhelm you and overtake you to the point where you can't function normally. So once you see that it's begin to affect you so much that you are not able to eat, you are not able to sleep for a prolonged period, you are not able to go to work, you can't do your normal functions, you can't take care of your children as you should, then that means you are heading towards a mental illness or a mental breakdown. So you need some sort of counseling at least. Usually when you are diagnosed, especially in the teaching hospitals, they assign you to a psychologist to help you to be able to process the information so that you know how to manage yourself.
Okay, and tell me, how can individuals support loved ones who probably have been diagnosed with breast cancer?
Yes, that's very important. And the very first thing I want to say about that is, first deal with your own emotions and your own like processes in your mind. Yes, your wife or your sister or your mother just got diagnosed. It also affects you too. So you have to be able to get your feelings in control. Learn to be able to accept how the situation is, know what you can do, what you can't do, and don't be overwhelmed. And try to have a positive attitude, because if you go and you are already crying, then what should the person
and for a husband who probably is thinking, oh, my wife is going to lose the breast, what am I going to do? He might even not be able to accept that news well enough to help the wife deal with it.
So the most important thing is you have to check yourself and then make sure you're able to control your emotion, because the person's already going through a lot. Otherwise they will feel burdened to have to comfort you rather. And it shouldn't be that way. Aside that, you also have to regularly check in on them and find out how they are doing. As much as possible, accompany them to appointment. Don't let them go for their appointment, their medical reviews and treatments alone. It's sometimes the treatments are very tasking. They make them very fatigued, very tired. So you try and help them as much as possible. If you help them with household chores and other responsibilities, so that they can rest after the treatment and all that. So you have to, and also, even if you are not directly like living with them, you can even assist their caregivers. So you can even assist the husband of the one whose wife who has the breast cancer. So maybe you can help him with his workload. Maybe you work with him. You can help him so that he doesn't have to spend so much time at work, that he can take time off to be with his wife and those kind of things.
All right, final one though. What resources are available for breast cancer patients and also survivors?
The only one I know of is the Breast Society of Ghana. And they have a lot of resources. They actually get like people to partner with them to help them go to treatments and all those things. Unfortunately, I don't have their direct links, but they are online. And they actually help a lot of women, help the survivors as well. So sometimes the survivors actually become members and also help other people going through it as well. But usually once you are diagnosed, there's a lot of those brochures and stuff are actually with the surgeons in the surgeons consulting rooms. So if you are treating your breast cancer as a traditionalist, you might not hear of this. But if you go to a hospital, you see a surgeon, I'm sure you'll be able to get access to a lot of these things.
You mentioned it, so I have to ask you, I was going to wrap up, but you mentioned the traditional. Do we know of traditional herbal medicine, for instance, that are used to treat breast cancer?
Not that I know of. The few that I have seen, they did not end well. So I would not advise it.
Because there are those who don't like the orthodox medication. They will say, oh, go and take some baby drew or something.
And usually then they end up coming at a very
late stage, and we can't do anything about it. And we've talked about the fact that early detection actually will give you a better chance of beating it.
So you come early and then you treat it, and you can join support groups and stuff like that. The psychologist will help you find a group in your area where you stay, where you can meet with people and survivors, and they encourage each other.
Okay. All right. Thank you very much, Doc, for coming on. It's been a lot. We need to digest it. Hopefully next week we get to wrap it up for the month of October. Thank you very much for coming on.
Thank you too.
All right, so that was Dr. Emefa Dzide from Wejagbawe Municipal Hospital, and today we talked about breast cancer. We looked at treatment options, prevention, and also some awareness creation as well. We'll wrap it up.